Yeah, so which diet is best studied in treatment of depression? There's a few studies. So there were a couple of studies that were spin-offs of a large study of the Mediterranean diet in Spain several years ago. This study, the target was actually on patients with increased risk of cardiovascular disease and how that dietary intervention would would decrease the development of heart attacks and strokes. But there were sub-analyses of this big data set that looked at depression as well. And they found, and I won't get into the details now, but you can read this up in the gut-immune connection in greater detail. There was evidence that it had a positive effect on depression. So people who were on the Mediterranean diet had a lower prevalence of depression. And then there was another study which is sort of interesting, and there will be hopefully many more of this, study by an Australian investigator, Felice Jacka, where they combined teaching in making Mediterranean dishes in patients with depression with the conventional, traditional antidepressive therapy, which could have either been cognitive behavioral therapy or medications. And they found that the group that had the additional dietary intervention actually did much better in outcomes of improvement of the depression than the group that did not have that. Now you could criticize that because it may also be just the fact that people that were involved in these dietary classes, these cooking classes, this had a positive psychological effect, and that contributed to the improvement. But there's other studies coming along now that a combined therapy with conventional treatments, medication, psychological therapy, with the dietary intervention actually has improved outcomes in depression treatment. So I would say it's also at an early stage. But again, like in the other conditions, the diet most commonly studied is a largely plant-based diet. So several variations of the traditional Mediterranean diet.